I'm Linda Miles of Virginia Beach, Virginia. It is my distinct pleasure, on behalf of my business partner, Robin Morrison, to be here as an invited part of AAOSH. And we're very proud, Robin and I, to say that Oral Cancer Cause, our nonprofit that we started 3 years ago, has been chosen by AAOSH as the arm for oral cancer. So thank you, AAOSH. Thank you. Did you know also that more than 60,000 people will be diagnosed with head and neck oral cancer this year? And every year, that number continues to grow. Did you also know a startling fact that fewer than 20% of all dental practices are providing a complete oral cancer screening to all of their patients at least once a year? Only 20% or less. I know that that 20% is probably in this room today. However, with only 20%, we have to ask the question, why, since it's standard of care for dental practices, and you are not dentists, you're physicians of the mouth, you're the only physicians of the oral cavity, why are they not doing it routinely to save lives? The first reason is that time is money, and it may take you 2 to 3 minutes to do a complete or ideal oral cancer screening, you or your hygienist. The second reason is that dental insurance does not recognize this important part of the comprehensive examination, therefore there's no reimbursement. The third reason is, sadly, a lot of dentists and hygienists haven't been trained to do one correctly. The fourth reason is they don't want to use the C word and frighten their patients that they're looking for oral cancer. And please, by the way, when you grab a patient's tongue with gauze and pull it out and look at all sides of it, tell them you're doing an oral cancer screening, or they're going to think you get your jollies pulling people's tongues out. I've had so many patients, and I'm not a clinical person, I'm a speaker consultant in practice management, but I've had so many client offices, the patients look at the hygienist or the dentist and say, wow, I've never had such a complete exam. I've never had that done before. And the fifth reason that a dentist wife shared with me is that her husband, who was very astute and who was very concerned about oral cancer, sent several cases that were false positives to the oral surgeon in his community. And at a dental meeting, he was ridiculed for being doctor over-diagnosing. So we'd rather over-diagnose than under. Is that not true? So in 2012, I knew Robin Morrison, but I didn't know her really well, and we had a conversation at an ADOM conference. And the conversation was that her brother Mike had just passed away with oral cancer. And as she shared her story of how their family had all pitched in and helped Mike not lose his home and his own business, he built million-dollar homes on the coast of Maine. He was a very generous man, and he gave a lot of money away, knowing he could make more, not really planning for a disaster such as dying at an early age. And Robin called and found that all other foundations provide research. And while research is very, very important, we can't ever undervalue the importance of that. We are the only, OCC is the only foundation that has all volunteer workers, including Robin and I, and we have a lot of champions who are championing. We have a lot of OCC dental practices. And when I met Robin, not only did Mike just die, but my sister-in-law, Charlotte, was at home with hospice and was dying with oral cancer. So when we talked about it, I said, you know, Robin, I wanted to start something about 5 years ago. Lee Tarvin, who's worked with me for 32 years, her son at age 42 had stage 4 cancer of the tonsil. And we talked about doing something at that time, but I was so busy that we didn't get it started. But when I met Robin, I knew she was the right person. She owns RLM Dental Marketing in Clearwater. She and I together have more than 80 years in dentistry. And we knew that together we could do this because we both had personal interest in doing something for the families. So we provide at OCC, we provide 100% of the money collected goes for the families when the breadwinner has been compromised. These patients can't eat, they can't talk, they can't work, they have feeding tubes. It's a very horrible, horrible, debilitating disease, as you know. And besides our marketing materials that we provide for all OCC practices, all the money collected goes. And we were very blessed from the first day because Robin went to a Foundation for Nonprofits luncheon, and in the community of Clearwater, one of the largest law firms takes on one pro bono case per year. Robin submitted what we were going to do, and we were chosen, which saved about $10,000. So we were very excited about that. And I was going to tell a story about one of our, when I speak on behalf of OCC and when Robin speaks, we like to share one OCC story. And as we were talking a month ago, I said, you know, Amber Young is our star survivor. She lives near Charlotte, North Carolina, and I was going to tell Amber's story, but I decided, Robin and I together decided, why not bring Amber to AAOSH and let her be around the people that are our tribe and let her meet as many of you. So she's here, and in the next 5 minutes, she is going to tell her personal story. Amber Young.
Thank you so much, Linda. I am both honored and privileged to stand before you today making my debut speech as an oral cancer survivor. My journey with oral cancer started in February of 2015. I made a new patient exam at a local dentist. We had moved to town, relocated, and part of my new patient exam was to have a panoramic and also to have an oral cancer screening. My dentist at that time noticed that I had a dark spot on the panoramic that was below the gum lines that she really couldn't identify. She took me back and did an additional 25 x-rays free of charge. Told me, take these to the oral surgeon, help locate the mass and see what you're dealing with. And I took those to the oral surgeon and we looked and got a better imaging, and at that point, you must realize I was a 35-year-old female, mother of two. I have an 8-year-old daughter and a 1-year-old son, healthy. I had no sign, no symptoms, no pain. There was no symptoms or any clues that would lead you to think that this would be the case. We took better imaging at the oral surgeon, and they realized my mass was the size of a golf ball, growing inside my right mandible, slowly separating my jaw, and it was eventually going to break it. So at that point, we took a wisdom tooth, did a biopsy, and sent it off to have a biopsy. And 2 weeks later, the results came in. We all went, my husband and I, scared to death. Got the best news ever. He said, you're cancer-free. It's wonderful. We just need to send you down to MUSC, and you need to have it removed because of the size and location. It's just too large for me to do in the office. So 2 weeks later, again, we went in for the meeting, and the head of the dental practice walked in and said, I know you're worried about your pathology. I said, no, that guy right there said everything was fine. And he said, actually, it reacted poorly with the K19 dye, and we've never seen this before. We need to re-biopsy. But let's go ahead, take it out as a mass and whole, biopsy the whole surface, and then deal from there. So we went in and had it removed, and they told my husband it was clear, there was no nodules, it looked very fine, and there shouldn't be anything to worry about. Another 2 weeks passed. We got the pathology report, had our appointment, drove to Charleston, which is about a 4-hour drive from Charlotte. That's where all my doctors are. And we were sitting there, and I took my children, my 1-year-old son, my 8-year-old daughter, and 9 doctors walked in the room. And I just knew at that moment this appointment was not going the way we thought it was going to go. So I remember sitting there staring at my children as the words came out of the doctor's mouth. They said, we've never seen this type of cancer before. We don't know how to treat it. Chemo and radiation aren't effective on it. There's less than 80 cases in the whole entire world since it was derived in the 80s. I said, what am I supposed to do? I walked out, being a millennial, went to Google, first thing I did. I tried to WebMD myself into a different diagnosis. But there was no information, no research, no studies. Everything was in the early 80s, and it was in third world countries. It metastasized into lung cancer. And the truth and the harsh reality behind it is there's not any survivors because it kills us within 5 years. So the official diagnosis was clear cell undogenital carcinoma. And I was told at that time I was the only person in the world with this cancer. I left there with nowhere to turn, nobody to talk to. There wasn't a support group, there wasn't a foundation, there wasn't anything that could help me. So for a month, my husband and I researched the best of our abilities on our own. We bought all the case studies from back in the day, read them, no known survivors, and really dealt with what was facing us. And on a whim, I decided to make a GoFundMe page. Really didn't raise any money, but within 24 hours of it going viral on social media, I had an email in my inbox from Linda Miles, and she said, I can help you, call me. I know what to do. And not knowing Linda or the Oral Cancer Cause or really any foundation that could help in any way, I reached out and I contacted her, and she connected me with a woman who had been in San Antonio who had had a jaw replacement and knew the type of surgery that I was facing, things like that. Then she also mentioned, you know, I've heard of this cancer before. I said, excuse me? She said, we helped another family last year with same diagnosis. I said, are you serious? And within the same day, I was on the phone with the only other known survivor with this type of cancer. He's what I call my cancer brother. And we are immediate family. There's no known root to why we have this disease. It wasn't environmental, it's not hereditary, there's no way to stop it. It's 95% aggressive. He's been diagnosed for 3 years, on his second reoccurrence already at this point, just finished his last surgery 2 weeks ago, and he's in recovery. So the harsh reality is we have to check for oral cancer. We have to be doing screenings. My cancer was rare, under the tissue, may not have been noticed, but I had a dentist who paid attention to that imaging and saw a tiny little dark spot that changed my life. My cancer would have killed me within 6 months if I had not found it. And so I'm only able to stand here today before you because of a dentist who did their job and went above the standard care practice, and because of the Oral Cancer Cause and the work that they do. They sent us a check, which allowed me to put my son in daycare. I didn't know that this that you see now in my tissue was actually bone and tissue taken from my scapula to replace in here along with a titanium plate. But to look at my 1-year-old son and know that I was going to go through recovery and not be able to pick him up and carry him, I didn't know what to do. They gave me the opportunity to put him in daycare and care for him while I went through recovery, and that is something that I could never pay these ladies back for. So if you have the opportunity to support a foundation, they do wonderful work. And I would like to thank all of y'all. I've learned. The wonderful Linda Miles. Thank you. Woo.